part of the abdomen, when fat get deposited, the patient is going towards PCOD in female patients. You can examine by examination also, observation also. When they are abdomen flat from lower part, they are not suffering with any other uterine hormone, uterine components. But when they are lower part of the abdomen is bulging outside and fat deposition more, they are going towards PCOD. But according to state only we have to take out. But only by that we come to know the ovary is functioning abnormal. The AMH level. We cannot give directly from medicine. But for correcting the ovary, atrophy can happen or swelling can happen. Because of that, you can consider those symptoms. Other medicine form this is sterility, cannabis indica, cannabis sativa, serum med. Note down these medicines. Morphine, Plumbomet, Sickle. This is from herring, Baratamur, Oromur, Brodium, Calcarea, cannabis sativa, Cantharis, serum. See, serum has come multiple times. This is the gradation. From this we can grade how much it will work more. Infertility, infertility. Iodine, Heluvinus, Calichrome, Lachesis, Natrum, Natrum carb, Phosphorus, Sepia, Sulfur. Other word is barrenness, barrenness. It is mentioned in Boric also, BBC also. Because barrenness in young people. Says infertility in syphilitic women, also in nourished was mentally suppressed because of their barrenness. Milipodium. Barrenness because of two produced menses. This is the searching word. You have to read at least one time mathematica. Otherwise, you cannot know which words are which word to use also.
And maybe you will get a confirmation also.
When we are seeing the menstrual pattern, read above one paragraph, below one paragraph. We will know the words also. By reading only, we should get up which new words are coming. Initially, it becomes difficult to read, but we have to do physical work more. Then later, when you practice, we will get oriented with those words. It becomes easy. Initially, I have done very hard work in those times. I have written each and every words I am having. By reading only, I take out the words. This word is for that, this was for that.
Like what do you suggest?
So what do you suggest? Read the words and group them.
See, now you are seeing the menses cases, then read menses from three books: Allen Encyclopedia, T.F. Allen, Herring and Harriman's. Mathematica pure also, if the medicines come from there. And read the remedy part, whole menstrual part, from the leucorrhea till the last part. Even consider leucorrhea also, don't consider only menses part. Read whatever it is given. Back cup remedy or practice remedy. Read from everyone. Each and other symptom can add also in symptom, then we can get oriented. Otherwise, we see language, what language they are using. Copious, profuse, those words are the same, na? Why they are using copious? We also don't know what is the reason, but we should know why they have mentioned. The meaning is other, why they have used copious, why they have used profuse.
Is there a difference?
Maybe different there. I don't know.
Collectively, we should study and discuss and come to know the.
I also don't have the answer regarding those questions. I will put a question regarding that also in the group. What is the meaning of absent menses, amenorrhea, late menses, related menses? Both all are same terminology. Which to take? Which medicine we should take? And what? Take everything in symptom then. Search the paragraph, whichever the lines is matching. Then only you. Or read the index or read the main preface before starting the remedy. It will give the action what the state it is. is again one case of infertility with a fallopian tube block. Apeksha Sabka, 21 years female, married, living from Aurangabad, married 7-8 months before, and case came in 5th February 2023. What was she was having? She was already diagnosed after they came to me. What I whenever I see the patient, I become blank. Do not keep any prejudice idea before patient, and don't question according to that line only. Keep blank, gather all information from patient, then only you consider what is the relation with the pathology. Otherwise, you are asking the patient according to pathology only. So keep your mind free and ask ekdam blankly. Keep your case paper blank and don't ask anything and keep and ask what is the main complaint and what happened. Note down and see the pathology, the relation or between the symptom narrated by patients and pathology. Then only you correlate.
Sometimes we see the diagnosis is wrong also.
It can become wrong also.
So I diagnose myself and then open.
Yesterday also that night case when we saw they had given anything regarding the PET scan, but there is no scan related spine, thoracic spine. The pathology is always in now initial pathology is there in thoracic spine only.
Yes.
Yesterday's case, and the pathology primary focus is in spine only. Later it has migrated or metastasis in lung.
But when we first see the case details, we will think it is here. So history taking can give diagnosis clearly.
What was the complaint? She had white discharge before marriage also. After marriage, it was increased. The discharge was leukorrhea was white and yellow color, severe itching and burning from the PV discharge. Before and after menses over 3-4 days after start, I showed words yesterday's. See what is shared before and after menses get over. After 3-4 days starts and continue further. This is venereal miasm symptoms. Leukorrhea before and after menses immediately starts after menses. She took many allopathic treatment for that. Then also there was no antifungal or suppository. They tried many things for white discharge. Nothing happens. Menses were previously irregular. Now after 30 days she has become regular. 30-day cycle and bleeding was 4-5 days and pain and before, during, after menses. If the patient is suffering, I told now also, if the patient is suffering with infection, she will suffer before, during, after painful menses. Whole uterus and fallopian tubes are painful. This is a signs of she is suffering with infection. Otherwise, they are purely hormonal indications. And she was anemic patient, and her last menses came in 27/1/2023. She was referred from a friend, Aurangabad friend in Mumbai clinic. They were trying to conceive, but it was not happening. We asked her to do the pelvic UHG and hormonal study with the report. In that we found all reports were normal, nothing was there. And before that also we suggested to do hysterosalpingography for tubal patency. Whenever such an infection case comes, then we should suggest hysterosalpingography. If there is no history of infection, do not go for hysterosalpingography. It is painful, I think. But if you are getting the cause of infection or any other in history, the infection is their uterus, then please confirm hysterosalpingography or a sonosalpingography to confirm the patency of the fallopian tube. Otherwise, you will give them medicine many times, it will not work anything. Then it shows left fimbriae and left fallopian tube was partially blocked, femoral end, and there was cervix infection after PV examination. When madam did the infection examination, they found there was cervical erosions were there, mild cervical erosions were there. After examination, physical also we can confirm it by Kalkos speculum, and the infection traveled from the vagina to the fallopian tube. This was the main cause, and it was more leukorrhea was there. This is the SHG report, femoral end partial block. See, minimal free peritoneal spillage observed in left sided, partial block near femoral end, and no hydrosulfins there, only baki cavity was normal. This was case. Now what is the analysis of the case? First thing is white yellow discharge and burning from the itching from vagina. Cervix ulceration was there. Cervix inflammation from long time. Whenever the infection happens, the cervix and vaginal inner area, all bacteria flora get disturbed, and because of that mucous membrane get eroded or accurate discharge passes. Before during menses abdominal pain and long time PID infection of uterus and cervix. So because of that they cannot conceive. This is the actual cause. What are the probable medicine for this from Prune Matermedica? Belladonna, Apis mellifica, Creosotum, Noxomica, Calcarea carb, arsenic, lacasis, Iparasulf, Lycopodium, mug salt and nitric acid. These are the syphilitic and this one psychotic medicines, and these are the soric medicines. Okay. I started with the mug salt LM0/1 potency, 10 strokes, 5 ml and 20 ml water, and I said to drink all water TDS, same dose. After 10 days, I told him to give follow up on phone call. After starting medicine, 3-4 days of burning and itching discharge reduces. See, the discharge also reduced before, and heat inside the vagina also reduced, which was unbearable. Okay, we told to continue the medicine, act properly, and we called later. Second follow up, she gave last time the menses of 27th January. This time the menses are properly 26th February. Menses bleeding 4-5 days. Bright red has compared to light quality was better. No abdominal pain before, during, after. White discharge and yellow discharge has compared last month was reduced. Burning, itching was reduced, and still he was having anemia. The anemia was present. Now I have to give antiseptic medicine on previous state. Okay. On remaining symptom, I gave him the next medicine, arsenic album, which was covering the other soric symptom. I gave him mineral myzum medicines. Then again I started with the antiseptic medicine, arsenic album. Dose was 10 strokes, 5 ml, 20 ml water, and drink all medicine tediously. Okay. In next follow-up, again, white discharge had completely stopped. Only she had called us yellow white discharge which was coming had completely stopped. No started as previous, like immediately after menses before, which was previously